Welcome to Review Central. This is Physical Therapist Licensure Exam Reviewer number 2. This reviewer is intended for those who are eyeing, or are set to take the Physical Therapist Licensure Exam given by the Board of Physical and Occupational Therapy, and administered by the Professional Regulation Commission of the Philippines. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous Physical Therapist Licensure exams. Before we proceed, don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Let's begin. Question number 1. Which of the following spinal orthoses limit lumbar extension and reduce lordosis? A. Taylor brace. B. Chair back brace. C. Williams brace. D. Knight spinal brace. The correct answer is C. Williams brace. The Williams brace is commonly prescribed to limit movement in patients with spondylolysis or spondylolisthesis. This rigid brace has a front elastic band, so you can bend forward, but side uprights limit how much you can bend from side to side. The Williams brace also reduces lordosis or the excessive inward curve of the spine, as well as limits lumbar extension or the bending backward of the spine. Question number 2. All of the following are therapeutic effects of vigorous local heating, except A. Decreased viscoelastic resistance to joint motion. B. Increased extensibility of fibrous connective tissue. C. Steady increase in enzyme activity as the temperature. D. Increased blood flow due to arteriolar and capillary dilatation. The correct answer is C. Steady increase in enzyme activity as the temperature is not a therapeutic effect of vigorous local heating. There is no evidence of correlation between enzyme activity and heat therapy. On the other hand, the rest of the therapeutic effects mentioned in the answer choices are indeed attributable to vigorous local heating. Question number 3. Properly set up electrical systems are necessary for safe functioning of a PT department. The factors to consider are: A. The electrical sub-panel should be within the department. B. All equipment in the department should be grounded. C. 110 and 220 volt power source must be properly labeled for distinction. D. All of these. The correct answer is D. All of these. Properly set up electrical systems are necessary for safe functioning of a PT department. First of all equipment in the department should be properly and substantially grounded to avoid accidents. The electrical sub-panel for the department should be installed within the department so that it can be easily accessed in case of emergencies. Since PT devices may come in either 220 or 110 volt ratings, there should be provision for both type of power sources, and these must be properly labeled for distinction. Safety is everyone's concern, so everyone in the department should observe electrical safety guidelines. Question number 4. Which of the following tests is not used to evaluate meniscus injuries? A. Anterior draw test. B. McMurray test. C. Appley's compression. D. Reduction click. The correct answer is A. Anterior draw test is not used to evaluate meniscus injuries. McMurray's test is performed with the patient supine and relaxed. The examiner grasps the patient's heel with one hand and the joint line of the knee with the other hand. The knee is flexed maximally, with external tibial rotation, medial meniscus, or internal tibial rotation, lateral meniscus. The Appley's grind test, Appley compression test, is used to evaluate individuals for problems of the meniscus in the knee. This test is named after Alan Graham Appley, 1914 to 1996, a British orthopedic surgeon, who discovered this assessment technique. The test is performed in conjunction with the Appley's distraction test. Reduction click is another maneuver to test for meniscus injury, very similar to the McMurray test. With this maneuver, the patient is supine, practitioner flexes the knee to 90 degrees and then brings the leg into extension with internal and external rotation. Palpable or audible click with extension is indicative of meniscus injury. Meanwhile, the anterior drawer test is used to assess the integrity of the anterior cruciate ligament, not to evaluate meniscus injuries. With the knee flexed to 90 degrees, the foot is stabilized by sitting on it. Question number 5. Local effects of cold applications include A. Vasoconstriction. B. Increased local circulation. C. Superficial penetration beneath skin surface. D. Increased leukocytic migration through capillary walls. The correct answer is A. Vasoconstriction. One of the primary outcomes of localized cooling is vasoconstriction, or the narrowing of blood vessels, within the underlying skin. It is thought that in some instances, cryotherapy may be causative of tissue necrosis and neuropathy via cold-induced ischemia leading to non-freezing cold injury or NFCI. Question number 6. A positive Trendelenburg sign results from paralysis of A. Hip abductors. B. Hip extensors. C. Hip adductors. D. Hip flexors. The correct answer is A. Hip abductors. A positive Trendelenburg sign usually indicates weakness in the hip abductor muscles, gluteus medius and gluteus minimus. These findings can be associated with various hip abnormalities such as congenital hip dislocation, rheumatic arthritis, osteoarthritis. Question number 7. The evidences that show circulatory improvement after massage. A. Redness of skin. B. Decreased swelling. C. Relaxation or sedative effects. D. Decreased muscle spasm. The correct answer is A. Redness of skin. Good circulation brings damaged, tense muscles the oxygen-rich blood they need to heal. Massage facilitates circulation because the pressure created by the massage technique actually moves blood through the congested areas. The release of this same pressure causes new blood to flow in, which is manifest in the resulting redness of the skin. Question number 8. Which of the following muscles could be weak or non-functioning when a patient demonstrates a foot slap on heel strike? A. Tibialis posterior, gastrocnemius soleus. B. Tibialis anterior, extensor hallucis longus. C. Tibialis posterior, gastrocnemius. D. Tibialis anterior, extensor digitorum longus. The correct answer is B. Tibialis anterior, extensor hallucis longus. Foot slap, also known as foot drop, slap gait, or steppage gait, is caused by weakness or paralysis of the muscles involved in lifting the front part of the foot, particularly the tibialis anterior and the extensor hallucis longus. The tibialis anterior muscle, also known as the tibialis anticus, is the largest of 4 muscles in the anterior compartment of the leg. Its thick muscle belly arises from its proximal attachment at the lateral tibia. The tibialis anterior tendon, TAT, inserts distally on the medial border of the foot. The extensor hallucis longus specifically extends the hallux, dorsiflexes the foot at the ankle, and inverts the foot. The extensor hallucis longus muscle is susceptible to several pathologies, including nerve injury resulting in foot slap, tendinitis, tendon rupture, and anterior compartment syndrome. Question number 9. The normal range of motion, ROM, of a patient's hip abduction is A. 0 to 45 degrees. B. 45 to 0 degrees. C. 0 to 125 degrees. D. 115 to 0 degrees. The correct answer is A. 0 to 45 degrees. Range of motion, ROM, is a measurement of the distance and direction a joint can move to its full potential. Hip range of movement is dictated by the ball and socket hip joint, which is made up of the femur and pelvis. They fit together in a way that allows for fluid, repeated motion. Hip range of movement is measured in degrees of movement. Normal movement of the hips allows for 3 degrees of movement, which means your legs should be able to move freely in 6 different directions within 3 planes. Normal hip range of movement is as follows. Abduction, 0 to 45 degrees. Adduction, 45 to 0 degrees. Extension, 115 to 0 degrees. Flexion, 0 to 125 degrees. External rotation, 0 to 45 degrees. Internal rotation, 0 to 45 degrees. Question number 10. A positive Ober test indicates A. Contracted gastrocnemius. B. Contracted iliotibial hand. C. Contracted iliopsoas. D. Contracted biceps. The correct answer is B. Contracted iliotibial band. The Ober's test evaluates a tight, contracted or inflamed tensor fasciae latae, TFL, and iliotibial band, ITB. If the ITB is normal, the leg will adduct with the thigh dropping down slightly below the horizontal and the patient won't experience any pain. In this case, the test is called negative. If the ITB is tight, the leg would remain in the abducted position and the patient would experience lateral knee pain. In this case, the test is called positive. You have just completed Physical Therapist Licensure Exam Reviewer number 2. If you wish to watch more Physical Therapist Licensure Exam Reviewers, check out our Physical Therapist Reviewers playlist. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming Physical Therapist Licensure exam, and we look forward to your fulfilling career and lifelong profession as a licensed physical therapist. Good luck and God bless.